for everyone for attending, and thank you very much, Dr. Mona, for accepting to share your experiences with us today. I just wanted to say a couple of things. I wanted to welcome everybody on board. This is a function that we've been hosting now for 3 consecutive, for 2 weeks, but this is the 3rd session over the past 2 weeks, and trying to address a basic concept, and that concept is the model of care is based on the principles of patient and person centricity. And the person today needs to address issues related to COVID-19. And we have to be innovative and think out of the box because these are unnatural times. And each system of care, we've been so happily delighted and proud of the different leads in the different clusters, thinking out of the box to how to better manage their patients during these difficult times. Dying patients, last phase patients are a frail and fragile group of people that we must not ever forget about. We've all had loved ones who passed away. These are difficult times for whole families. So we want to make sure that we don't lose sight of them during these difficult times. So without further ado, thank you very much, Dr. Mona. You can go ahead and share your experiences, and we'll be happy to facilitate later on.
Mariam, thank you so much, Dr. Mariam and Dana, Diana, everybody who worked on this and arranged this. Thanks for the invite. I'm going to talk about last phase during the mob crisis, during the difficult time. I'm sure that everybody everywhere and in all systems of care is doing something similar or maybe even better, but I will try to summarize how we're taking care of our patients nowadays, and I hope that we can learn from each other to better do things for the sake of the patients. So I'm going to focus on the virtual part of things that we were forced to, forced may be a harsh word. I think we were directed to go to, and it's not a bad option. It's just another way of doing things. This is my wonderful team. I have to say thank you to my wonderful team as well. Without them, nothing would have been possible, and the patients would have been suffering kind of. So alhamdulillah, I'm lucky to have a very enthusiastic team and focused on the patient and the patient-centered care that Dr. Mariam spoke about. So as I said, we were going virtual. So we went, our clinic went virtual, our rounds went virtual, our consults are virtual, and our home visits are becoming virtual as well. On top of that, our bereavement services are virtual. It seems to me that what has been tying all those things together is having a helpline service. I attended a virtual session, I think it was a couple of weeks ago, about helpline or hotline and how it helps patients. And I just want to say that it really makes the huge difference in a situation like we're having nowadays. We've used phone, WhatsApp, Zoom to have those virtual encounters with patients, and alhamdulillah, it's been going well. The key or the strongest tool that we've had is communication. Effective communication is what is needed in order to fulfill all the goals that we set for our patients. This is an extraordinary time. It's not something that we know. It's not something that we're trained to work through. This is our first pandemic. I don't think anybody here is older to have lived another pandemic before. It's new for patients, it's new for relatives, and it's new for us as healthcare providers. Patients are afraid, they're isolated, they're extra emotional, and there are a lot of uncertainties. So putting that in the back of our minds when we communicate, when we talk, and when we take decisions about patients and how we are going to provide care is very important. The most challenging questions that we've been receiving during this difficult time was about opioids and about hospitalization. Opioids, we've had a lot of issues, especially in the first couple of weeks in the beginning of the lockdown. And patients were afraid that they're not going to get their medications. We're talking about pain and comfort here. So it's a very delicate area for patients and relatives, and having the security of access to opioids is very important. So specifically when Qatif was locked and patients couldn't get to Dammam from Qatif, this is where there was bloom in emotions and fear about opioids. We tried to deal with this uncertainty that we are not certain as well. We tried to focus on expressing our limitations, but at the same time, we wanted to reassure patients and families that we're there. All the calls were answered. We explained that you have your medications. We will walk you through how to get away with what you have until we can supply more medications to you. We've used adjuvants that are available in the quarantine area rather than only in Dammam. So alhamdulillah, now the opioid tension has gone down with the process that I'm going to talk about in a little bit. But this was one of the biggest concerns. The other question that we've always been challenged with is admission. We are dealing with very sick patients at the end of life. They have a lot of uncontrolled symptoms, and culturally it's really acceptable that they spend those difficult times in a hospital. Sometimes the nursing needs are too much for patients to be handled at home. This has changed during this time. The number of patients admitted at the hospital went lower than 50% in palliative care. We've worked with families and patients to focus on comfort at home. We've explained that this is for their own good. We don't want to expose them to infection unnecessarily, and we don't want to expose them to a hospitalization that will not benefit. If the care that we will provide in the hospital can be provided at home, we are focusing on staying at home and doing things at home as much as possible. So the helpline, we used to call it a hotline, but I think 2 months ago we decided that we are going to change the name to a helpline service. We've launched our service in April 2019, so a year from now. The service started to be offered during work days from after hours from 4 till 11 p.m. We didn't have a service during the weekend, and it was only one line operational. We do have 2 clinical nurse coordinators alternating sometimes in covering this service, but usually not both at the same time. So during the COVID era, the service is running 24/7 now. Weekend, weekdays, all the time, and with 2 lines open at all times. It's very difficult to give accurate data about what we've been receiving from calls and reasons for calls, but I do have some documentation from one helpline. 72 calls were received during 7 weeks from March 7th till April 15th. I'm sure this is also an underestimation, but sometimes we don't count if there are multiple calls, consecutive calls related to one patient, or calls happening in a sequence or over a few days if there are no interventions. But the number I have is 72. Prior to this COVID thing, we've had about 23 calls per month. So in relation to the number of patients we have, the number of calls that we're receiving now is way higher compared to previously. We also receive questions and inquiries through WhatsApp. The other phone line has about at least 10 chats per day, so 10 patients to deal with. Why do people call us? Usually it's related to medication, how to take medication, dosage, refill, side effects. Other reasons why people call are when there are new events, like for example, fever, bleeding, fall, whatever new symptom happening. Patients also call when there are uncontrolled symptoms, and for other reasons. For example, when they need supplies, or when they need someone to check on the patient at home, request a home visit or request a clinic visit, and so on. The time of the day when patients call, the peak time is usually between 4 p.m. and 8 p.m. Patients do call during the day, do call afterwards. Patients even call after midnight and before Fajr prayer also. The helpline service is covered by our clinical nurse coordinators, and I can't thank them enough. Their role has been so intensified during this crisis, tying things together and tying information together and connecting patients to the team and to the services that they need. I can't thank them enough, Sarah. Our clinical coordinators have experience in palliative care for at least 8 years. And nowadays, I feel if I'm to answer the call or my coordinator answers the call, we would give the same answer. Alhamdulillah, we are speaking the same language, and we are giving similar recommendations. Is there a question? No? Okay. So virtual clinics and remote consults. The clinics are done virtually through the phone between the physician covering the clinic and the clinical coordinator. We try to keep up the communication and the contact with patients so that they don't feel that they're isolated, even if they can't come to the hospital. We've had remote consults happening in Qatif. A lot of the clinic visits or new clinic visits are new consultations. So we are receiving new consultations from our Qatif oncology team. Our clinical coordinator, who lives in the quarantine area and who is working with that team, receives the consultations and evaluates the patients and calls the physician in Dammam or calls me in Bahrain, and we review the chart and review the data we have, and we come up with a plan. It's really about empowering our healthcare professionals. We don't need a physician to do all those services for patients. Nurses and nurse coordinators are trained, and they can really have a lot of input in the services we provide. Now regarding opioids, as I mentioned earlier, it's been one of the biggest challenges during this time. Opioids, the problem with opioids, unlike other medications, it's not expensive. It's not about price. It's about custody. When opioids are prescribed by physicians, they need to be dispensed to the patient or a first-degree relative. The relative needs to show the ID and needs to sign, or the patient, needs to sign that they received the medication. Without having that physical link, it's not possible. So when our patients were locked in Qatif and couldn't reach Dammam, there was no way for us to deliver medications to them. And no way for them to get into our hospital to receive the medications themselves. So our pharmacy, our narcotics and controlled drug pharmacy, worked out a process that was approved by our medical director in KFSHD to find a way to transfer this custody from one pharmacist to another until we reach inside the quarantine area. So the medications will be ordered via the virtual clinic. The coordinator will send a list of the patients who need opioids to the narcotic and controlled drug pharmacy. In the pharmacy, the medication will be issued. Then pharmacist one in Dammam will receive custody for those medications and take the medication, deliver them to the checkpoint between Dammam and Qatif. And at the checkpoint, custody will be transferred to another pharmacist who is a KFSHD pharmacist living and working in Qatif area at the checkpoint. So this other pharmacist 2, will take the medications to a primary healthcare center, and patients will be contacted to meet this pharmacist in the health center and receive their medication. We will do the same natural process of getting the IDs, copies of the ID, and signature upon receipt. And those forms or documentation of refill or dispense of medications will go back to KFSHD pharmacy in the reverse process. We've been trying to be very careful and keeping the confidentiality and not spreading the information about who is doing what in this process. We don't want to put our pharmacists in a point where it's known that this person carries opioids and so on. So it's done confidentially, and only patients who will receive the medication will contact this pharmacist or will get contact with the pharmacist. Regarding, alhamdulillah, it's been running well. Patients are receiving their medications, and if they don't receive the medication, they communicate with the helpline, and we find where the process went wrong, and we work on fixing it. Regarding patients outside Dammam, Khobar, and Dhahran and Qatif, we have patients living in faraway places and who cannot receive opioids and cannot reach to Dammam to get their opioids. So alhamdulillah, nowadays things are becoming more flexible in the favor of the patients with the Saudi FDA and the Ministry of Interior regarding opioids. So now we are allowed to send opioids through courier mail to hospitals near patients' residence in places where far away from Dammam, and pharmacies there. Of course, there is communication all the time between Dammam and the other pharmacies. So the pharmacist there will contact the patient to receive the medication from that hospital's pharmacy. Alhamdulillah, a lot is happening. To me, this was the biggest achievement. It was a dream to deliver medication somewhere else for patients. Alhamdulillah, it worked out well. Regarding the home visits, we've limited the home visits that we're doing as much as possible for safety of patients and of our healthcare providers. And we've been doing more calls than ever. For some situations, a visit is really needed, and when a visit happens, I've been very happy to participate through Zoom to see my patients at home. For people who know me, I love doing home visits, and I've been missing doing that. So alhamdulillah, شوي تعويض and I see patients through Zoom. So the nurse would be there, and because there's an issue, and she would need support of a physician, and families would need communication with the physician. So we've been doing that. We've limited the visits to patients who are actively dying with panicking families who are having uncontrolled symptoms. For example, last week we've had a patient who had seizures for 30 minutes like 3 to 4 times a day, and needed to be visited. For patients requiring patient-controlled analgesia pumps at home. In the COVID time, we've had 2 patients on PCAs at home, alhamdulillah. We've had 1 patient who needed OPAT, outpatient parenteral antibiotic treatment, to avoid hospitalization for highly resistant infection. And we've needed to remove a paracentesis catheter, for example. So the visits were limited to the absolute need that couldn't be done otherwise. But I know that home care patient teams are doing wonderful things all around the cluster. Teams are delivering medication, delivering supplies, food. It's just beautiful to see how the community is coming together and trying to help out and going beyond what's there in our job description. Alhamdulillah, wonderful things are happening, alhamdulillah, and Allah yajzihum khair, everybody who's trying to help patients at home. We do have a remote home team working in Qatif that we've been coordinating, and they are doing the same delivery of medications and all. Even before this crisis, we've done virtual meetings for the interdisciplinary team between Qatif and Dammam, and it worked well, alhamdulillah, ba'ad. And it's nice to see how we can connect, even if it was from a distance. And then last but not least, our bereavement services. This crisis has caused a lot of restriction and isolation, and our patients have been, patients everywhere in the world really have been dying alone and in hospitals and away from their loved ones. And it really saddens me that sometimes we can't help it. And it's for their safety and everybody's safety. It's still sad. In our inpatient palliative unit at KFSHD, we've had 13 mortalities. The number of patients, as I said, is way less than our usual number, and that's why the mortalities are less. Still, it's a big number for 7 weeks. Only 1 patient died alone without a caregiver. Unfortunately, a patient from Hassa whose family couldn't stay with him and couldn't reach. The team tries to offer support to the patient and the caregivers. Even the caregiver, having 1 caregiver is not enough sometimes. The caregiver needs support and needs another caregiver to help them through this difficult time. So the team's been replacing family physically, social workers, psychologists, nurses, and physicians, being the extended family inside the hospital. We've also intensified our bereavement services. We do bereavement calls after any patient dies in our unit, and our social worker has been intensifying those calls and calling more frequently to check on people, acknowledging the special difficult circumstances of the death and difficult circumstances of funerals and all that. Alhamdulillah, we're working on more and more methods of improving how we are connecting with our bereaved family members, and we're trying our best to offer as much support. We're also not forgetting, so this is my last slide, sorry. We're also not forgetting our trainers, our trainees, I mean. We have recently acquired 5 new residents to help us with last phase initiatives in our cluster. And they only joined us in February, so I really hated for this learning enthusiasm to go away during this time. So a simple thing, we've created a WhatsApp group for our trainees to share resources. We share online courses. I share a topic at least once a week, and I share a quiz in palliative care once a week. And we discuss and review the topic virtually. For those who are interested, I really recommend this very useful free course that's available online and was prepared by the World Health Organization virtual course on fundamentals of palliative care. For those of you who never looked at it, it's worth looking at. And of course, simple things. We use SurveyMonkey for the quizzes, and we use Zoom and WhatsApp voice notes also. So it was my last slide. I hope that it was useful, whatever I shared. We're all praying for a better tomorrow. Inshallah, Ramadan comes, and it's a new start for wonderful things, inshallah, and for safety and comfort. I would love to hear from you.
يعطيك العافية دكتورة. Thank you so much. Very, very wonderful. صراحة information and knowledge and everything.
Thank you.
Dear attendees, any questions? أي أحد حاب يسأل أي سؤال للدكتورة؟ أي أحد حاب يعرف أي معلومة؟ Feel free.
السلام عليكم.
عليكم السلام.
معك الدكتور فوزي العودة من الرياض.
كيف أخبارك؟
كيف حالك؟ أخبارك؟
الحمد لله. الله يعافيك.
أولاً أشكرك على المعلومات صراحة طيبة وسريعة. أمسي على الإخوان جميعاً والأخوات. حقيقة في عندي قصة بسردها لكم. ما أدري all attendees عربي ولا في عربي إنجليزي؟ Do we have English?
العربي يعني.
لا عربي.
طيب.
عربي دكتور، خذ راحتك.
طيب، احنا في الطب التلطيفي زي ما ذكرتي بارك الله فيك نعتني بالمريض وبالمرافق، وحصل عندي referral last week through this pandemic. هذا الريفيرال انه المرافقة عفوا she's sad in tears and she's not talking to the team, the medical team.
Yeah.
So I visited the patient. She was unconscious. I took the daughter outside the room, and I interacted with the watcher. She was in tears and she was sad. I asked her ليش الدموع هذه ايش في؟ she said to me إنه علاقتها في أمها قوية و she wants to continue caring for her mom. She does not want her sister to step in. طيب why are the tears؟ بتقول I have final exams and البيئة في المستشفى هنا مو بيئة دراسة وأنا I'm an A student وأخاف إنه أفشل. أقنعتها إنه أنت you are doing your role with your mom وهذا very nice of you, may Allah reward you. بس now في مرحلة الدراسة مش غلط إنها تيجي أختك وتوقف مكانك مؤقتا حتى أنت تهتمي في مستقبلك. صحيح إنه أمك أهم مخلوق عندك وأعز مخلوق عندك، لكن الآن في مصلحة عظيمة وهي الدراسة. قالت طيب النظام الآن يمنع إنه اسمه زوار ويمنع مرافقين. قلت we'll take care of this issue، أنت ما عليك، بس توافقي أنت إحنا إن شاء الله بنحل هذا الموضوع. فوافقت الحمد لله
الحمد لله.
وتم الموضوع. بس حبيت I wanted to share this with the group يعني. Thank you.
دكتور فوزي،
نعم.
thank you for sharing this. يعني هو sometimes patients need the excuse، يحتاجون يسمعونها من شخص ثاني كأن أنت تعطيهم كأن الإذن. you are giving them permission to do what they think is right. It's wonderful. I know it's been very painful for people not to alternate، يعني إن يجي مرافق ويروح مرافق. You know, I have a patient who's been in the hospital for at least 5 weeks من هاي الأسابيع يعني، and she's very sick and she can't go home. فبنتها محكورة معاها هاي الفترة كلها. She can't leave and she can't have someone relieve her. فالموضوع وايد صعب في المستشفيات هالفترة. فجزاك الله خير، يعني فعلا هم يحتاجون السبورت من the team، من everybody who can support them.
Thank you.
يعطيك العافية دكتور، شكرا على المشاركة. Anybody else؟ أي أحد عنده story؟
If I may، يعطيك العافية دكتورة منى. really يعني impactful and really amazing initiative that you've taken with the patients. I had a question around, do you see there is in the future an opportunity to use some of these virtual solutions to deliver care to palliative patients in a more let's say يعني efficient manner, given we know إنه في نقص في consultants والكوادر الطبية that can support والأسرة and all of that. How do you see strategically in the future this can be taken forward in a way that is still fulfilling up a good and يعني safe secure experience for the patient and the caregivers?
Thank you for this. هو سبحان الله ساعات تصيبنا المواقف الصعبة علشان we are pushed to do the right thing. We've always wanted to have virtual care. It's not the same thing. Let me tell you, أنا في البحرين الحين وكل شيء قاعدة أسوي virtually. I really miss being there physically. I really miss holding hands and touching my patients and making them feel that I'm there for them. But this crisis have taught us that things can be done in a different way. But it's not a bad way. It's not. It may be. I'm not even going to say it's not up to the standard. يعني بالعكس, it taught us how to reach to patients. I think it's we should continue doing that. احنا كنا عندنا تجربتنا مع القطيف كنا نسوي هاي الشيء، يعني نسوي rounds virtually حتى إذا في patients during the visit they would call me during the visit or they would show me a wound or something يعني لا علاقة بالمرضى. ف we've done some of it before، بس الحين that we have the real life experience and this really works. I think we should expand and expand more. نسمع تفضلتي عدد الناس اللي في palliative care خاصة في الشرقية قليل جدا جدا. In our cluster we only have 2 palliative care consultants. To stretch those physically is very difficult, but virtually I think it is doable. We will not let go this virtual thing لما نرجع حق الحياة الطبيعية, of course, I think.
Thank you very much.
Can I have a comment please?
تفضل. هلا دكتور سامي.
الله يعطيك العافية دكتورة منى. Nice presentation. I was listening while I'm driving between the hospital in the cluster. But anyway, it's worth it to interfere. We in cluster 2 have experience. I think it's worth it to share it. We have what we call it outreach program. Outreach program that it is deal between 2 organizations, between King Fahd Medical City and King Salman Hospital in Hai. And the distance between the 2 organizations is 700 kilometers. and the deal is to cover all the service of palliative care through the KFMC service, and for 24 months. And we started in the end of 2018. Before the COVID crisis happened. And we trained all the multidisciplinary team in King Salman Hospital, Hail. And usually every month there will be a physician, consultant physician will go there and cover the service for a whole month. And it went perfectly. Until the moment we face it with COVID, where the physician locked down and there was no permit to cover other cities, and you cannot, like what you have, Muna, now in Bahrain. So we cover it through a virtual clinic. We start to open, we are gladly having 4 assistants in King Salman Hospital for 1 year experience, and they have virtual meetings discussing all the activity and the planning, and sometimes they can having the simple tools like what we call it Zoom application, and we are watching the patient as same as a physical, and we give advice in spot, and it is happening now for almost 6 weeks ongoing, and believe me, the impact and appreciated from the people in Hail area and the patient and even the stakeholder there. It was amazing.
ما شاء الله نتعلم منكم دكتور والله. هاي التجربة أنا I've been following it. ما شاء الله التجربة جميلة يعني. We tried outreach مع حفر الباطن and الحسا hospital حتى قبل سنوات من الأزمة. بس we've had issues with opioids, وبعدين كان a number of patients it was not feasible at that time. بس I think إن نفس ما تقول الواحد يتعلم من يعني الحين هاي الموقف خلانا نشوف إن virtual everything can be done as if we're there physically. فبالعكس تجربة حلوة.
believe it, دكتورة منى, when we start the seeing patient in palliative care unit in King Salman, the first month it was only 2 to 3 patients. But after the successful of these patient treatment, everybody they cut off from all the different part of kingdom, and they came back to their hometown to seek the treatment in King Salman. And we reached one time almost 18 BCU patients there in the Hail area, which is territories. Yeah. And now with the COVID, the total patient is 8. Which is quite amazing. That and the second thing, I'm rarely seeing any patient from Hail in our hospital or in King Faisal Hospital or even in National Guard from Hail area. So they will finish all the oncology treatment and immediately they will continue their palliative care and supportive care in Hail.
الحمد لله. I think this is هاي هو التوجه بعد الحين مع الحسا والحفر الباطن again يعني. فيعني سبحان الله تعلمنا التجارب يعني الحمد لله. I think we will do more of that virtual communication حتى عقب ما تخلص الأزمة.
يعني الحمد لله الآن كان في obstacles خاصة الناركوتكس، بس الآن بعد اللايسنس اللي أخذناه إنه ممكن يرسل عن طريق الDHL وال other company.
يعني it's amazing.
It make life easy.
حلم.
الله يعطيكم العافية، وإن شاء الله المناطق الأخرى في المملكة نفس الشيء يكون.
يا رب.
Can I say something relevant to what Dr. Sami had said? I remember قبل العقد اللي تم بيننا وبين مستشفى الملك سلمان بحايل لما كنا نحول المرضى من مدينة الملك فهد الطبية دكتور سامي لمستشفى الملك سلمان، كانوا الناس يرفضون. كنا نواجه مشاكل مع المرضى والمرافقين، ما يبون حايل، يبون الرياض. الآن ما حد يجينا من حايل الحمد لله.
لأنه صارت الثقة دكتور، صح؟ يعني هم if they feel that this is the same team, they see the same faces, the consultant is there covering. أكيد الثقة تلعب دور كبير. الله يعطيكم العافية.
الله يعافيك يا دكتور.
Any more happy stories?
And I don't have a story, but I wanted to say thank you very much, everyone, for your input. You know, there's always an issue with, you know, with when you start a new practice, you're going to have resistance. It's going to be difficult to get people on board, and so on and so forth. And I think, Dr. Sami's story and Dr. Fawzi's story very beautifully demonstrated how they were able to overcome these changes. It took a while, but slowly but surely they were able to do it. And maybe again, one of the, we try to be optimists and look at the positive outputs of COVID-19. Usually people shy away from doing something and they say, there is an area of improvement. It's still not perfect. The reality is it's never perfect. And maybe COVID is pushing people to start and do it, and then improve upon it, which is really the way that it's supposed to be done, and that alleviates a lot of the resistance. And when people start, like the experience of Dr. Sami and his team, they realize it works, and then they will be able to take it up even more and own it and become accountable for it. So maybe again, this is a prime time to capitalize on virtual solutions, on establishing things, even though it's not a perfect time and it's not a perfect setup, but there is a definitive need going forward.
هو as you said دكتورة مريم، هو change is difficult for everybody. يعني أتذكر أول مرة سويت rounds على زوم، even my team resisted. يعني إنه لا، وشلون نسوي، وإحنا مش حنفتح الفيديو وتعالي إلى تتكلمي معانا في تليفونك، كل واحد بروحه. ف small changes شوية الساعات الناس يخافون منها ويكشون منها، بس once it works. وهذه فرصة نفس ما قلتي إن it's pushing us towards doing the right thing. حتى لو كان مو perfect، ويمكن الناس يحسون بالconfidence إنه let's do it even if it was not perfect because of the situation. لكن يعني if this is what it takes, this is what it takes.
Thank you so much, Dr. Mona, Dr. Mariam, everybody. Any questions? Any stories? Any suggestions? Nothing? Are we good?
I think we are good, and we need to keep a palliative care cafe like this in another part of the world.
We have another cafe في our cluster, but it's not really palliative care. It's الحين موضة كافيز دكتور سامي.
خلاص
بعد كافيه ثاني.
يا رب توزعون النشاط على يا رب.
الله يعافيكم.
Okay, then if we are all good, then we have to end up our... Yes? All good? Okay. دكتورة احنا ما نبغى نخليكي تروحي، عرفتي، متمسكين ننتظر الى الساعة 2 ان شاء الله.
اي وقت على الزوم موجودة.
حبيبتي انت يعطيكم العافية، يعطيكم جميعا العافية. You can always reach us through our WhatsApp, through our email, and دائما أرقامنا موجودة، ودائما we are one big family. Feel free to ask, feel free to share your information, and just speak up and be good. Take care of yourself, ونشوفكم إن شاء الله بإذن الله in another knowledge cafe. يعطيكم العافية وبحفظ الله.
مع السلامة جميعا، ورمضان كريم إن شاء الله علينا وعلى الجميع.
وأنت بخير الصحة والسلامة يا رب.
And please let us know if there is any feedback. We'll be happy to receive it. Thank you very much.
Sure.
شكرا جزيلا.
شكرا، مع السلامة.
Thank you so much all for joining. مع السلامة، كل عام وانتم بخير.
وانتم بخير، الله يسلمكم.